Let's begin this class with articulators. Articulator is defined as a mechanical instrument that represents the temporomandibular joint and jaws to which maxillary and mandibular cars may be attached to simulate some or all mandibular movements. What is the need for use of articulator? Articulator is used for diagnosis and treatment planning, for fabrication of occlusal surfaces for dental restorations, for arrangement of teeth in complete dentures and partial dentures, and it can also be used for patient education. The advantages of using an articulator. Better visualization of occlusion is possible with use of articulators. Patient cooperation is not a factor. Refinement of occlusion is easy. There is reduced chairside time and patient appointment time. It also becomes easier for us to visualize the occlusion from the lingual side. Procedures can be designated to the auxiliary person. Patient's saliva, tongue or cheek are not the interference factors. However, there are limitations like error in tooling can result in metal fatigue and wear and does not duplicate all the condylar movements or mandibular movements in the temporomandibular joint. The movements simulated may not be the functional movements. The requirements. Articulator must accurately maintain horizontal and vertical relationship of patient's cast. The patient's cast must be easily removable and attachable to the articulator without losing the horizontal and vertical relationship. The articulator should be able to open and close in a hinge-like fashion. The articulator should have an incisal guide pin with positive stop that is calibrated and adjustable. The articulator should accept a phase bow transfer. It should be accurate, rigid and should be made of non-corrosive material. The moving parts should resist wear. The design should have sufficient distance between the upper and the lower members so that vision is not hindered. Additional requirements are condylar guide should allow right lateral, left lateral and protrusive movements. If the condylar guide should be adjusted horizontally, there should be provision for adjustment of lateral movements as well. Incisal guidance table should be mechanically adjusted in sagittal frontal planes or should also be able to be customized. The special requirements of the articulator are it should have an adjustable intercondylar distance and should have an adjustable immediate Bennett movement. Now coming on to the factors for selection of the articulators, it depends upon the skill of clinician. Restorative procedures and occlusal schemes should be able to be planned with the help of articulators and understanding the limitation of the articulator.